Okay, let's do some organs for this test 4. Okay, this is the kidney, and well, if I were to hold it here, you can kind of see it's a little 3D there. On the outside, we have the renal capsule. If you think of the kidney as like a kidney bean, the capsule would be like the shell. Okay, so this would be the shell or the renal capsule, and renal denotes kidney. When you see the word hepatic, that's liver. Gastric refers to the stomach. Okay, so we have renal capsule, and you can see it's cut here. It's a little thin part there, and then this part here is called the renal cortex. And then these dark red things in here are called the renal pyramids, and between each pyramid is a capsule. Now, not necessarily a continuation of the cortex, but if you want to think of it that way, so remember, cortex into the columns, and then renal pyramids are here with the pyramids and the columns making up the medulla, renal medulla, and this would be the renal pelvis. Up here is the gland that sits on top of the kidney, so we're going to call that suprarenal gland or adrenal gland. Okay, and that's the kidney. Let's go to the only time you're going to see this now. You know what that is? That's a stomach. All right, so we're done with that. And now let's talk about the colon a little bit. Okay, so the colon sits here, and here's a small intestine, and where the small intestine meets up with the large intestine is called the cecum, C-E-C-U-M, and this would be the ascending colon, right colic flexure, or bend, I guess, transverse colon, left colic flexure, descending colon, the gray, and then on into this one shows a little bit better. You can, here it is there, turn it around. This would be the descending colon, right? Because it's like this, pull the small intestine out, so turn around. Here's the descending colon, sigmoid colon, and rectum. Now what's also important here, we talked a little bit, there's a video on here about the hepatic portal system and the inferior vena cava and all that, that drains the abdomen and the arteries feed it. But let's talk about the mesenteric arteries and veins. Okay, so here's the colon. If you turn it around, okay, here's the descending, right? Here's the ascending. If you remember, the superior mesenteric artery feeds the ascending colon and transverse colon, and here you see it here. So this would be the superior mesenteric artery. This would be the superior mesenteric vein, that lavender right there. In fact, on the models, on the torsos, the lavender are the part of the hepatic portal system, whereas the blues are the inferior vena cava, for FYI. Okay, so this would be the, again, this is ascending, is a superior mesenteric artery and vein, and this would be the inferior mesenteric artery and vein going here on the descending colon. Incidentally, the rectum is drained not by the hepatic portal system, but by the inferior vena cava system, and so I think it's like 2/3. The distal 2/3 of the rectum is the inferior vena cava. That's why when sometimes suppositories are used, because if you put them from underneath, it bypasses the liver because it bypasses the hepatic portal system and enters the heart and enters the system right away. Whereas if you were to ingest it first, then it goes to the liver. Only one bypass though, and then by the second time around it goes to the liver. But immediately though, it does go right into the system because the rectum is drained by the inferior vena cava, not the hepatic portal system. And then this one's broken off, but you can kind of see it here. Okay, here it is again. Okay, this is where the colon begins, and that little tail right there called the appendix. And that is it for that.